Hello everyone, welcome to my channel, Learning Center with Hanif. In today's video, we will learn about the Antibiotic Sensitivity Test, also known as the AST. This is one of the most important laboratory tests used to identify the most effective antibiotic for treating a bacterial infection. What is an antibiotic sensitivity test? An antibiotic sensitivity test is a laboratory procedure used to determine which antibiotics can effectively stop the growth of or kill the bacteria causing an infection. The test helps doctors choose the most appropriate antibiotic instead of prescribing medicines by guesswork. Why is this test important? Not all antibiotics work against every type of bacteria. Different bacteria respond differently to different antibiotics. If the wrong antibiotic is used, the infection may not improve, and the bacteria may become resistant to treatment. An antibiotic sensitivity test helps. Select the most effective antibiotic. Avoid unnecessary use of antibiotics. Reduce treatment failure. Shorten recovery time. Help prevent antibiotic resistance. Improve patient care and treatment outcomes. When is this test recommended? Doctors may recommend this test when a patient has a serious bacterial infection. An infection does not improve after antibiotic treatment. The infection keeps recurring. The patient has a urinary tract infection, wound infection, bloodstream infection, or other bacterial infection. The doctor needs to choose the best antibiotic before starting or changing treatment. How is the test performed? First, a sample is collected from the infected area. The sample may be blood, urine, sputum, pus, throat swab, or other body fluid, depending on the type of infection. The laboratory first grows the bacteria from the sample in a process called culture. After the bacteria have grown, antibiotic discs are placed on the culture plate. The plate is then incubated for a specific period. If an antibiotic prevents bacterial growth, a clear area called the zone of inhibition appeared around the antibiotic disc. Laboratory professionals measure this zone to determine whether the bacteria are sensitive, S, intermediate, I, or resistant, R, to each antibiotic. Understanding the results. Sensitive, S, the antibiotic is expected to work effectively against the bacteria. Intermediate, I, the antibiotic may work under certain conditions or at higher concentrations. Resistant, R, the antibiotic is unlikely to be effective and should generally not be used for treatment. Advantages of the test. The antibiotic sensitivity test provides accurate guidance for treatment. It helps doctors prescribe the right antibiotic, reduces unnecessary antibiotic use, decreases healthcare costs, lowers the risk of complications, and supports efforts to control antibiotic resistance worldwide. Important advice. Never take antibiotics without a doctor's prescription. Always complete the full course of antibiotics, even if you feel better before finishing the medicine. Do not share antibiotics with others, and never save leftover antibiotics for future use. Responsible antibiotic use protects both individual patients and public health. Conclusion. In summary, the antibiotic sensitivity test is a valuable laboratory test that identifies the most effective antibiotic for treating bacterial infections. It improves treatment success, reduces unnecessary antibiotic use, and helps fight the growth of antibiotic resistance. Thank you for watching this video. If you found this information helpful, please like, share, and subscribe to Learning Center with Hanif for more educational videos about laboratory medicine and healthcare. See you in the next video.